Hi everybody. So today I wanted to go over some really simple exercises that I give to an awful lot of patients in the office. This is a great reminder for those that should already be doing these exercises, and this is something new for those that have not seen these exercises to try something new. So these exercises are based on working on your core, your balance, and stability. And so like anything new, obviously give your body a chance to adapt to these new movements, allow your muscles to change to the new patterns that we're going to try to put them through here. So go slow. If you have any questions, make sure you ask your healthcare provider if these are right for you or not. And if it feels wrong, we'll use common sense and just stop, right? So the first one is we call it knee up. And it is what it sounds. You're just going to bring your knee up. So when you're standing against the wall, use the wall for stability, for sure. You're going to bring your leg up and down. But the key with this exercise is not letting your foot touch. That is the key. You want to work at this movement, and at the top position, you want to keep your knee at 90 degrees, your hip at 90 degrees. You don't want to be tipped off too far to the side. You want to try to have the upright posture. If you think you're tipping off, do it in front of a mirror so you can take a look at your posture, right? And of course, you want to switch sides. You're going to find that, one side is going to be stronger than the opposite side. And again, start off doing 5 times. And when you do 5 times, then go to 10 times, then work your way up to 30 times. So this is the beginning style part of it. The more advanced part is taking a step forward, away from the wall, and doing it just in free space. You can see that is a lot more difficult, particularly on carpet for sure. On a harder surface, it's actually easier. And do the other side, of course. You want both sides to be balanced for sure. So the second exercise we work on is we call it knee ups. Sorry, we call it kick ups. Kick outs, that's what it's actually called. Sorry about that. So it's called kick outs, or we sometimes make the joke that we call it kicking the husband. So the way this one works is that we kick out. And we kick out, so the idea is you want to keep the 90 degrees here, and you want to just kick your leg out. Again, starting with 5 times and working up from there. And the same thing over here, 5 times and working up from there. And then of course, making it more difficult, we take a step away from the wall, and we're going to bring our leg up, and we're going to kick out, and kick out. And kick up, and you can definitely see that it is definitely more difficult, and you're gonna have a weak side and a strong side. So the key with those first 2 exercises, they're the warm-up, because the most important one I think is what we call kiss the wall. And this is the first 2 exercises, warm some of these muscles and hips up for this exercise. So we're gonna make sure we get a different angle over here. The key with this one here is you want to make sure your feet, you can start off in the beginning style here. You want to have your feet about 1 inch away from the wall. And the whole idea is to squat down into the wall. If your knees hit the wall, that's fine. But the whole reason for the wall is there so your knees can't go too far in front of your toes. So you want to get to this. You want to try to get this part of your leg parallel with the ground. And again, work at doing your 5 up to 30 times. And then for the advanced part, you're going to slide your feet into the wall, and it gets quite a bit more difficult. All the way down as best as you can. And up you go, right? All the way back down. And up you go. So the whole reason why we want to do this is that when you do chores around the house, whether it's preparing food or lifting, I don't want people to lift like this. This is bad for your back. We want you to sit down into your pelvis and mimic that kiss the wall positioning, right? You want to try to keep your knees in line with your toes. You don't want them to go here. You want to try to keep them down. You want to squat down to your pelvis. Even when you're doing things like brushing your teeth or doing your hair in the bathroom sink, don't bend over the sink this way. Try to bend over the sink this way. You'll notice a big difference for your back. It's going to save your back. It's going to help your back for sure. So there you have it. Some simple things you can do at home. Give them a try and let me know how you make out.